How to do an intramuscular ozone injection. In this video, I will demonstrate how to inject ozone into the ventrogluteal muscle in a step-by-step process. I'm Paula, the crazy ozone lady, and in this video, I will show how to inject ozone into the muscle, which is more on the side of your body instead of on your back. So I will show here how to inject the ventrogluteal instead of the dorsogluteal muscle. An injection into the ventrogluteal muscle has several advantages. First of all, it is easier to access if you're injecting yourself. Then there are no major blood vessels close by, so there's less risk of accidentally hitting a vein or an artery. And yes, ozone can be also injected into the vein, but it requires a completely different technique to guarantee the safety of the process. See my book, DIV for the Super Paranoid. Another advantage is that there are no critical nerves, like for example the sciatica nerve, which could be accidentally injected as well. If you want to know how to perform intramuscular ozone injections into the dorsogluteal muscle, then go to my website where you will find a detailed guide with lots of pictures. And before we begin, a disclaimer. This video is only for informational and educational purposes and not meant as an instruction to treat yourself. For that, please consult a doctor or a licensed healthcare provider in your area. Now, this out of the way, let's begin with the preparations. Any type of ozone production for therapeutical means always starts with the oxygen source. And ozone injections require oxygen of the purest quality, so it has to be either medical oxygen, O2-ready oxygen, or another high-quality type like ultra-high purity or scientific-grade oxygen. To learn where you can legally obtain this type of super pure or medical oxygen without a prescription, watch my other video I made on the topic or go to my website. You will of course also need an ozone generator. Here I use the PromoLife Dual. A syringe filling station with an ozone-resistant 0.2 micron filter, a 10 milliliter syringe, a hypodermic needle. Here I use a 26G 1-inch or 25 millimeter one. Alcohol wipes, cellulose pads or cotton gauze, band-aids, sterile syringe caps, a sharps bin to dispose of the used needles, and an air-filled glove if you're injecting yourself. If you're injecting someone else, you won't need it, but you will need gloves for hygienic purposes. First, make sure everything is clean, that your ozone generator is hooked up to the power supply, and that your equipment is set up correctly. Now you're ready to open the oxygen. But before you do this, you need to make sure that the syringe filling station won't be blocking the gas flow. So remove the syringe cap, disinfect the filter on the syringe filling station with an alcohol wipe, and set the off lever to point towards the destructor. Then open the oxygen tank. Half a turn on the valve is enough. You will see the gauge jump up, which will show you whether there is gas in the tank or not. You then set the regulator to half a liter per minute. After setting the regulator to half a liter per minute, wait for 15 seconds to flush the lines and the filter on the syringe filling station with pure oxygen. Now it's time to flush the syringe with just oxygen. For that, connect the syringe to the filter on the syringe filling station. Be careful, this will go really quickly because of the high flow, so keep your hand close by. When the syringe is full, turn the off lever towards the syringe to close the oxygen flow. Unscrew the syringe and empty it. You have now flushed the syringe with pure oxygen to remove any air from possible dead spaces. Screw the syringe back on. You can now let go of the filling station. You're ready to fill the syringe with ozone. For that, select the desired ozone concentration. Here I choose 22 micrograms per milliliter, which means that at the given flow of half a liter per minute, I have to set the first cell to 5 and the second to 2 on the PromoLife Dual ozone generator. I now wait another 15 to 30 seconds for the generator to warm up and to flush the lines with ozone-oxygen gas mix. Once this is done, I open the syringe port on the syringe filling station by turning the off lever towards the destructor. When the syringe is full, and this will go pretty quickly, I close the syringe port by turning the off lever towards the syringe. Next step is to turn off the ozone generator and then to set the regulator to 0. I recommend doing this right away, otherwise you will forget it and find your tank empty the next time you'll want to use it. So close your tank right after having filled the syringe and after having turned off the ozone generator. Unhook the syringe from the syringe filling station and screw on the needle. Put the syringe with the needle aside for a moment. Now prepare and mark the injection site. For that, you first need to identify the spot where you will be injecting. And here's the simple trick how to do this. Place the center of a hand over the hip bone, the greater trochanter, with a thumb pointing towards the front of the body. The index and middle finger should touch the top part of the iliac crest. The space between the index and the middle finger is where you inject into the ventrogluteal muscle. Since you can't place your own hand on your hip to find that spot, you can use an air-filled glove instead. When you have found the spot, you mark it by pressing with the needle cap against your skin. This will leave a small indentation. You then disinfect the area, take off the cap, and push out a few milliliters to purge air from the needle. Then you inject the spot in a 90 degrees angle. Preferably, this should happen in one quick motion, not as slowly as I'm doing it here. You then aspirate, meaning you pull on the plunger to see if there's any blood coming into the syringe. If there is, this means that you hit a blood vessel and you need to abort the procedure. If there is no blood, you can now proceed by slowly injecting the content of the syringe. I recommend placing yourself in front of a big mirror if you're injecting yourself. There can be a feeling of pressure and a burning sensation while you push the gas in. After you're done, you remove the needle, take cotton gauze to press on the injection site and keep pressing for a few minutes to stop the bleeding. You can then put a band-aid over the puncture wound. Dispose of the needle in the sharp spin. Release the pressure from your regulator by first closing the valve on your oxygen tank and then by opening the regulator all the way up. Watch the gauge go down quickly. This is how you protect and maintain the longevity of your regulator. Once the gauge has gone down, set the regulator back to 0. Done! Hey, I have not felt any pain while doing this, whereas when I was injecting myself into the dorsogluteal muscle, there was some considerable discomfort. But then I was also using the bigger, more unwieldy syringe. Also a note for anyone who has bought my book about DIV ozone injections. Yes, I was using less precautions when fitting the syringe here than what is described in my book, since this procedure does not deal with injecting ozone into the vein, but into the muscle, which is less risky and so does not require all those many safety measures. Personally, I do not see a lot of value in intramuscular ozone injections. I'm not a big proponent of this procedure. If I needed an extra ozone kick because I had the cold or influenza or some other infection, I would rather go for vaginal insufflations or ozone saunas or even drinking ozonated water. I would expect a bigger systemic effect from drinking ozonated water than from injecting 10 or even 20 milliliters of ozone into my butt. But there are others who would disagree with me and who claim that this is a valid systemic treatment, like Dr. David Brownstein appears to think. He used intramuscular ozone injections, among other measures, on some of the over 100 patients who were sick with you-know-what, and all of them recovered completely. So then, what do I know? Well, actually a thing or two when it comes to ozone therapy, which is why I decided to put a large part of it into yet another book of mine, this time around about home ozone therapy. and which is why you should be subscribed to my newsletter. So for this, just go to thepowerofozone.com/news and type in your email address, and you will be among the first to be notified when it comes out. Also, if you want to know where you can get all the stuff that I used in this video, just check the description below. This is it for now, dear Ozone Rebel Gang. Remember to keep it pink for no particular reason at all, and go eat a damn steak. See ya.